Hi, and thank you for coming. My name's Emma Donaldson. I'm a doctor in the northwest of England. I'm a senior trainee in gastroenterology. And I'm presenting on behalf of a group of junior trainees who are working at the moment, seeing patients. As a lot of the previous speakers have intimated, this is the training structure in the UK, and this is for all training, but everybody within the yellow box rotates. So you're not based in a single institution or with a single group of people. Junior trainees, F1, F2, rotate within organisations, between departments, every 4 months in our region. More senior trainees rotate every 6 to 12 months between organisations. And that can lead to this feeling that the trainee isn't part of either the small team or part of the big institution that team is based within, that they're an outsider until they become a permanent member of staff. But trainees are important to organisations because trainees see the detail, and they see things very differently to somebody who's worked within that organisation for 20 years. And they can ask the questions by virtue of being new that you would never think to ask about the way things are done, about the way patient care looks. And listening to what they have to say and giving them a voice is very important, and that's what this programme is about. This isn't to read, this is just an excerpt of the curricula that show that quality improvement and patient safety is a core feature in all of our curricula for very junior trainees, specialist surgical trainees, specialist medical trainees. It's of interest that medicine mixes up safety improvement and health and safety. So as part of your safety improvement training for medicine, you also have to know about running in the corridor, what to do in a fire, and lifting large heavy boxes. And that causes some confusion when you talk about safety improvement work. So what I'm going to tell you about is the TICKLE programme. And the way I've looked at this is from social media theory. So there's been a big focus in this conference on using social media. And we don't use social media particularly with our junior doctors, but I'm going to use this as a framework for looking at our project. So if you're a company with a Facebook site, it's thought that 90% of the people that look at your site lurk. Okay? 9% contribute every now and again, and 1% contribute the majority of your likes or comments on your Facebook site. And one of the keys is to try and encourage some of these lurkers to become contributors. And that's what we want to do with trainees. They lurk on the periphery, learning to be doctors, and they see things, and we want them to contribute to the organisation, to patient safety and quality improvement. So there's 5 things that it suggests companies do to improve their social media usage. 1, make it easier for people. And there's this really radical concept that if you want to undertake quality improvement, it's helpful to have some skills in quality improvement. So we teach them. And we teach them model for improvement, we teach them reliability, we teach them about human factors, we teach them about measurement for improvement, and we use their regular teaching sessions that are provided by the deanery that they're already attending without their pagers in a protected fashion to deliver this teaching, to give them some skills. Make participation a side effect. Amazon do this very well. You buy a book and it gives you a list of books that you might also like to buy. You don't have to think about what else you might like to buy. You buy a computer and it suggests you might also like this cable and this case and a desk light and a few other bits and pieces. So it's the same thing. If you join a surgical ward in our hospital, what's going on? You're only there for 4 months and you're trying to learn to be a doctor. That's not a lot of time. So we have a register, and every audit and quality improvement project is registered. So we hold a register. We know corporately what projects are being carried out and who is involved in those at ward level. We know what we're involved with as an organisation in terms of national or international collaboration. And therefore, we can say, you're starting in August on this firm, this is what's going on. This is what you can get involved with, just by being there. Edit, don't create. Look at what's already there, look at what people understand, and change it into something that's more fit for purpose. Audit has been something within the NHS that we've done for a long time. But you don't practice medicine by audit. You don't practice healthcare by audit. You make a diagnosis, you suggest a treatment and start a treatment, and then you measure over time. And you look at blood pressure and respiratory rate and go, is this pneumonia getting better? Yes, they are. Excellent. Carry on. No, it's not. Go back. Have you got your diagnosis wrong? Make a new prediction. Start a new treatment. Measure over time. You practice healthcare by quality improvement. So doctors are trained. It's what you do at medical school, is learn about quality improvement. This is just applying it in a slightly different context. So we have a lot of national audits where we provide data for assurance on our adherence with standards. And we have a lot of these audits that are in the action plan phase, where the changes have been implemented before the next audit. That action plan phase can become a quality improvement project. So by saying, we know these are the big projects, here is your baseline data, we can help you turn that into something, the next step. We can take it from stamping the audit box to being a change within the organisation. We reward participants, but don't over-reward them. Okay? You don't get out of your on-call by participating. You don't get extra holiday for participating. You don't get paid more for participating. You do get to present at an alternate monthly patient safety forum to other junior doctors and to senior doctors and to senior nurses across the organisation. You can write up your project, and we publish it in a very exciting PDF on the intranet so other people can see your work. And we give you certificates for your portfolio, which is important for showing that you're involved with things, with the training boards. And we promote the people who are at the top 1%, the quality contributors. We promote them. So we've made the committee of junior doctors that set this up officially recognised within our organisation, so they report to board on the activity of junior doctors. They have a voice at executive level. We support them putting posters in for conferences. We support them writing up their work, and the ones who are super enthusiastic and don't get out the room in time, we put on the steering committee to shape the direction of the programme. As I said, I work within the quality improvement department. This is something I support. These are the people who make this happen. The top 3 people on that list are junior trainees. They are newly qualified doctors within our organisation who are busy seeing patients at the moment. And they're the people who made this work. And they're the people who deserve the credit, and I'm privileged to represent them. And their message today is, don't just tick the box when you can tickle it instead. Thank you very much for listening.
Did you come up?